Elysia Bronson here, and I'm a registered clinical counselor with the BC Association of Clinical Counselors. And today we're going to talk about cognitive processing. This is by looking at the I should have statements that creep in. We call this shoulding on ourselves. So the goal is processing the way individuals recognize and challenge the thoughts and beliefs that are causing them distress. We start by stretching our self-awareness. We call this mental yoga because we're stretching how we think about things. When we start processing, we want to recognize that it may be really uncomfortable, becoming more aware of your thoughts. And when we find core beliefs, we want to investigate them with curiosity, flush it out a bit, and process what comes up with it, noticing if there's any associations to other thoughts. To build resilience and awareness, we use a scale to check in on your distress levels. This will help us see you grow. So in this, we usually say on a scale of 1 to 10, with 10 being completely overwhelmed and not coping, and 0 being totally chill, where do you find yourself at right now? And that'll give us an idea of how distressing the thought is. We want to use this scaling question before and after to just notice the physical reactions and feelings that come up. This is how we'll grow your growth. Grow your growth sounds funny, but it's how we stretch you and how we notice and observe that it's happening. There's changes. Each week we notice differences. And if your stress is too high, we'll pivot to our emotion regulation skills. This will help with mindfulness and grounding. And every time we use mindfulness and grounding, it just brings that 10 down to an 8 or an 8 down to a 6. We lower it slowly the more we ground in the present. As we go, this process of cognitive processing will create greater self-awareness of how the trauma affected you, and in it you'll also grow as you reshape your thoughts and beliefs. This self-awareness stretches us, like doing some mental yoga. We have all these cards in our toolkit, and we want to use them to look at how we process rigid thoughts and how we can reshape them and make them more flexible. We will also look at the core common beliefs that are tied to these stuck points, as they're often found to be affected by trauma. And that's how they come back up and be brought up to help us look at the question where the pain is coming from. We notice with chronic illness, there's some gaslighting that's happened, or there's some thoughts or beliefs we have about ourselves that come up. With trauma, there's the things we should have done. Those are the steps. So here we also see on the bottom of it some symptoms that come up with traumatic events. This can be mood swings, disconnected feelings, avoidance, withdrawal, and so on. We have lots of things that come up after a traumatic event, and those are totally normal things for handling a situation that was really scary. So if you face what is scary and nothing had happened to you, eventually you'll start to feel a bit better about it. So when we're talking it through, and slowly our body gets used to that feeling of safety. The questions we use when we investigate our trauma is we look at that scale of where we're at, 1 to 10. 10 being overwhelmed, we look at hyperarousal. We notice symptoms in people like clenching, sweating, people getting high heart rates, and not being able to breathe. Avoidance is when we won't talk about it at all and we'll switch the subject a lot. So when we're asking these questions, as a therapist, we're checking in with where you're at on that level. These are common things that get hit. The core beliefs around safety, power and control, intimacy, trust, and esteem. So these are all thoughts that other people have that are like yours. These are themes of core beliefs that can be affected by trauma, like the event was my fault. What stands out here for you? We'll look at them with safety. In therapy, your safety is really, really important to me. So let me know if you feel your level of safety changes. Note that it's totally normal to experience intrusive thoughts related to the past traumatic event, as well as negative thoughts about yourself and others and the world around you. These are kind of things that come from having trauma, and they're totally normal. These events can make us hypersensitive to perceived danger around every corner. They make us feel unsafe, no matter where we're going. And we can turn this fear of danger inward. And when we don't find danger outside of ourselves, sometimes we find danger in here. Sometimes, if the feeling is safe, but I've been through trauma, I might get scared in here that something with me is wrong. For example, many clients report shame-related thinking with thoughts like, I'm dirty now, or I'm bad, or I'm a monster. Often clients with PTSD come with thoughts related to trust or safety. Trust is another big one. Some clients may believe that they're responsible for what happened to them during a traumatic event and get stuck feeling guilty about it. We can feel guilty for it for a long time. They may think that they're weak or experience symptoms of PTSD and experience a number of thoughts related to control or being out of control, such as my symptoms mean that I am out of control. This can happen with chronic illnesses and trauma. And this can be painful thoughts to have, and often they're very black and white thoughts. Yet, when we look at the questions in this section, we want to get into the gray, looking at the nuances of control. So things aren't always black and white. If we go on the belief that we can't trust anybody, we may be shutting out people who are trustworthy because we were hurt in the past. And this can get in the way of things that we want in the future. So we want to look at these trust issues and find a way forward. Next, we want to look at power and control. Sometimes power dynamics play a big role in trauma. When you look at these photos, who's likely to be in charge in these relationships? So let's look at a couple main areas that play a role. What age were you when it happened? That might affect the way you think about it. Did you at that age have any control over anyone else? Or control over their feelings and behaviors? Can bad things happen to good people? Why? Those are questions that we'll look at in counseling. A lot of our relationships have control and power dynamics that are unspoken. When you look at these photos, what are the power dynamics you see here? When you think of your relationships, are you in control of other people's behavior? Or are they in control of their own behavior? What were you responsible for? Sometimes we can understand this logically, but it's harder when it reaches our hearts because there's no way of holding on to it. What do you think about these things? For example, when you go into a doctor's office, who's in control there? Who is in control in your situations, in your relationships? Then let's look at self-esteem. This is often a fickle thing. We're taught to have high self-esteem or good self-esteem, and sometimes we often associate ourselves with low self-esteem. But self-esteem is something that floats in the wind. It's not a stable thing. And a great way of understanding the relationship between your thoughts and feelings is through looking at this and the possible function that it plays in your life. So let's look at some of these questions. What's the story your brain is telling you? What's the intended function of the thought? Or maybe what do you think it is? What do you hope to accomplish with that thought? What feeling is it feeding? And do you want to look at whether it's an accurate statement or not? Now at home, something to practice is keeping a thought monitor. Now why would you do that? Just like with losing weight, you need to monitor your intake of negative thinking. When we're changing our feelings and beliefs, we need to monitor our thoughts and processes that affect them. Thought patterns that are negative and unhelpful will maintain low mood and low emotions. And that's the same for what we pay attention to. If we're paying attention to a lot of news or negative things, we're going to feel negatively too. There will be an impact. If we watch a lot of dramatic TV, we might feel tense a lot of the time. So, paying attention to our thoughts usually also helps us notice when there's distortions. So, focusing on them helps to regulate your emotions better. Practice will help you to recognize how these core beliefs affect your interpretation of yourself and the world and others, which is an important work. And that might be something that you bring in with you to counseling sessions. When you have a thought monitoring journal, you notice the ones that are really important and then bring them in to talk about. And that can be really helpful for your journey. That's all I have for you today, and I hope it was helpful. Let me know if you have any questions or if you need any help along the way. I'm more than happy to help.